or
This
some questions.
conference will now be recorded.
Was I? Oh, yeah. Okay. All right. So a little bit about vaccines, and I'm infectious diseases, so I'm kind of passionate about vaccines. An immunologist from Stanford said that it's the single most life-saving medical innovation ever in the history of medicine, and I cannot agree more with that. And just so you know how it started with the smallpox when Dr. Jenner in 1796 has inoculated an 8-year-old boy by taking pus from the cowpox lesion. So this is the beginning of vaccination. And here, just very quickly, to see how many cases there were of smallpox before and after vaccination. Before is the big blue column, and then after is the no column, basically. So it was very effective. Now, a little bit about vaccines. I'm not gonna read through this busy slide, but the principle of vaccines is that they introduce some material from the pathogen that they're trying to deal with, and they give the message to the immune system that, hey, this is how the organism looks like, or a small part of the organism looks like, and then the immune system starts making different proteins and different little things in the body to so that when actually the body sees the organism, it will be aware and it will attack it and destroy it. So this is how vaccines work, and this is how COVID vaccines work as well. And there are different technologies for them, but they all do the same basic thing. They present the body with the information. The body recognizes the organism, produces immunity, and is then on standby. And when it sees the actual organism, it goes ahead and attacks it so that your body does not become sick with the virus in this case. This slide is talking a little bit about herd immunity. It tells you that it's a community protection that is created when a high percentage of population is vaccinated. We're talking about 70% for COVID. It may be needed to be a little bit higher, but the number that you hear everywhere is about 70%. But it decreases the likelihood that the particular infectious disease is spread. And it is why is it important? It's important for those patients who are either immunocompromised and so they do not mount a good immune response, babies, the ones that are just too young to be vaccinated. So basically, the herd immunity is trying to protect everyone else who cannot, for some reason, get vaccinated or has a suboptimal response to the vaccine. A little bit about COVID-19 in numbers, and they're here just for your information. You see there the number of cases. You see that we're over 3.5 million deaths worldwide and close to 600,000 in our own country. And then you see at the bottom the number of vaccines, the vaccine doses that have been administered already. And you see the numbers are, I don't even know if I know how to read them. It's really big numbers when you look there. So a little bit about these vaccines that we have available in the U.S. There are many other vaccines out there, not that many, maybe 3 more out there, and there are some that are in the process of being researched. But basically, the Pfizer and the Moderna, that are the ones that we have used a lot in our institution. They are mRNA based. There are 2 doses. The Pfizer is 21 days apart. The Moderna is 30 days apart. They are effective 95%, and this has been demonstrated in numerous trials. It has been shown in the real life data and so on. The safety was also demonstrated in very many studies. Also, interestingly, we have some CDC data in 35,000 pregnant women, and these are all healthcare workers because this is who was the first one to get vaccinated. But very important to know that it showed baseline rates of adverse outcomes comparable to the general population, and there are no safety signals. And I cited there for you the paper just in case you want to go and look for the actual data. And the data is pulled out of the vaccine registry that is maintained for COVID-19. Pfizer applied for FDA approval. I know this is one of the questions. Why do we want to vaccinate with a vaccine that's only authorized and not approved? But Pfizer has applied for FDA approval on May 7th, and it will probably take a month or two for everyone to review the data. The reason why they haven't approved so far is because they needed 6 months of solid post-implementation data for them to be able to submit to FDA. Is just what the rules are. So just so you know, the FDA approval is in process. There's no doubt in my mind that it will be FDA approved in a couple of months, probably. The adverse effects are mostly mild and moderate. They are self-resolving. The severe ones are under 2%. There are safety databases. The VAERS is for physicians to put it in there. The VSafe is self-reported. You can get it on your phone and you can report in there. Now be careful, they will call you, but it's very good to report because this is how we get our signals. This is how we know whether this vaccine post-marketing is safe or not. Everybody's asking about anaphylaxis. The study in JAMA showed that out of the 1.8 million first doses, there were only 21 anaphylactic reactions. They're all within 30 minutes, so this is the reason why we ask you to wait after you get your shot. Because if it's past 30 minutes, there just has been no report of anaphylaxis past 30 minutes. All of these patients survived and recovered and discharged within 2 days from the hospital. So this is about the Pfizer and Moderna. A little bit about Johnson & Johnson. This is a different technology. It has a replication defective adenovirus vector. It's an older vaccine technology. It's just one dose. It's indicated in people more than 18 years old. And it is 66.3% effective at preventing lab-confirmed COVID-19 illness in people who did not have prior infection. And people had the most protection, just like with the other vaccines, 2 weeks after getting vaccinated. But beyond the 66.3, so we need to understand that this means lab confirmed. So, nasal swab that was positive. But the vaccine has a lot higher efficacy at preventing hospitalization and death in people who did get sick with it. And no one who got COVID-19 at least 4 weeks after receiving the Johnson & Johnson had to be hospitalized, which I think is excellent. I think it's great news. This is a little bit of real world data. Just know that there is a lot of data. The first sets of data have come from healthcare workers, obviously. There is a very large Israel database. They have had exclusively Pfizer, and so for that exclusivity, they have promised to deliver the data, and they did. It is published and peer-reviewed. And it does show that the vaccine is very safe, and it has been very effective in their country. And I put in here some very interesting data that has just been reported by CDC on May 17th, so very recent. They looked at 123 million people in the U.S. that have been fully vaccinated. 123 million. That is a big number. So out of these, only 2,000, not even 2,000, have had hospitalized or fatal vaccine breakthrough cases. So in other words, they were vaccinated, but they still got the disease. And yes, we know that the vaccines are, around 95% effective. So we do expect that 5% will still get the disease. But I think this is really powerful, a powerful number, that out of 123 million, you only have 2,000 hospitalizations. There are some footnotes here talking about the fact that 25% of these, they were basically asymptomatic and not related to COVID-19. So I think this is as good as it gets. These are just some pictures from our own hospital, from the middle of the pandemic, really. This is the hallway in 6 West on the right side, and then the ante room you see in there, and then those 3 bins that you see are full of syringes from our first vaccine clinic. And then at the bottom, that's my husband just a week ago, after he successfully intubated a 40-something, I'm not going to give a whole lot of information here, but a young female who arrived to the hospital with severe COVID-19, required intubation. He was happy because during intubation, her oxygen saturations have dropped to less than 50%, and he managed to bring it back up after intubation. So this was just last week. So no, COVID is not gone. Some of you may think, oh, numbers are really low. They are, but we're seeing that the population is skewed towards the younger patients. We started to see that some of them don't have the traditional risk factors that we're used to, whether that is due to some of the variants. What is it due to? We don't know yet, but they're still coming. They're still severely ill. Unfortunately, all of these folks who come in with severe COVID, they have not been vaccinated. We are yet to see in our hospital someone with significant COVID-19 disease who has had the vaccine and had completed the vaccination series. So I think that's very important to know. These are some of the concerns that were expressed by persons who are not yet vaccinated. People say it's rushed. We addressed this in a previous WebEx. The only thing that has changed, the vaccine was developed exactly the same as the other vaccines. The only thing that's changed was the red tape that was surrounding all the stuff. So all the stages basically have had all the bureaucracy cut down, and so this is what made it come to fruition so quickly. Some people say it's experimental. The Johnson & Johnson is an old vaccine technology. It's nothing experimental about it. The mRNA vaccines, these are fairly new technologies, but not unknown technologies. They have been looked at for more than 20 years in vaccines and also for cancer research. So they're not quite new either. There are other things: lack of faith in institutions, value freedom, fear of vaccine more than fear of illness, which really shouldn't be the case. Some don't want politicians to tell us what to do. I second that. I didn't take it because the politicians told me that, but because I did think that it was an effective and safe vaccine. Some want education and not indoctrination. That's why we're here, to provide that education. Vaccine mandates, they're not here yet. They may be here. We don't know. Right now, we do not have any vaccine mandates. And I think that's all I have, or maybe a dozen. Yeah, okay. There are a few other things that circulate out there, and I just listed them in here. None of that is remotely true, but it's one of those things. This is the information about the vaccine clinic that Lori has shared with us earlier. Thursday, June 10th, 7:30 a.m. to 1 p.m., dining rooms 4, 5, and 6. There will be drawing for prizes, and the drawing will take place at 2 p.m. So come and get your shot. We're here to support you if you have questions. One of us will always be available to answer those questions. If you still have any reservations, whether you talk to us, whether you talk to your doctor, please talk to someone who knows about the vaccines, and just make the right decision for you. That's kind of all I had to say. I don't know if there are any questions. So we're going to open it up for questions here. And Marie, do you want to talk a little bit about anything with this?
No, I just want to reiterate everything that Dr. Chirca has said about the value of the vaccines. We've had such good success here at university, not only on the campus, but on our other sites. So we've had vaccine clinics at a couple of the Baptist churches around the area. We've gone to Aiken, and they've been very successful. The people that have come have been very appreciative, and we've been so honored to have been able to provide this. We've had different people that have said by having the vaccine, they feel like they're free to live their lives again. And so that's another point that we want to make. We're doing this because we feel that this is what's in the best interest for all of us as healthcare individuals, as family members, as members of the community. So please consider this. And once again, Dr. Chirca's here, I'm here, Kim Sagas is here, if we can answer any of your questions.
So one of the questions that just came through is, how are the vaccines holding up against all the variants?
All right, so one of the questions, how are the vaccines holding up against variants? That's a very good question. They have done some research, the companies did, looking into that. They are not 100%, they're not 100%, they are not as effective against variants as they are against the wild type, what we came to consider the wild type virus, but they are still fairly effective. It ranges anywhere between 50% and 85%, depending on the variant. And as you know, there's South Africa, there's the Brazilian variant, now there's the Indian variant, so there are a couple more of those. And so it is still effective. It is still better than not having any. How do I pull this? How do I pull these questions up?
You want me to just read them to you?
Well, yeah, but how can we?
I don't know.
Is there any way we can pull it out? I'm sorry, I'm just trying to
go to this maybe.
To pull up my questions here.
Right here.
Okay, wait. Okay, I got you all up. So, so I hope this answered the question. They're not perfect against the variants, but they're better than nothing. The companies, the manufacturers, feel that they are effective enough that they don't feel the need to tweak the vaccine. But if the need will come, they will. The next question is, will we need a booster? This is another good question. I don't know. The answer is I don't know. I will tell you that some of the data shows that natural immunity goes up to 8 months. That's so far. It could be going more than that. So, you know, there may be that we may or we may not. We don't know. Another question is, are there any contraindications regarding becoming pregnant? If I understand the question correctly, you take the vaccine and then you are thinking about getting pregnant, there is no problem with that. The vaccine data in pregnancy, I'm trying to go back to the slides that I have. No. Okay. I'm trying to get back to the slide that I had about the pregnancy. Okay, here it is. So kind of in the middle of the screen, you see the CDC data in 35,000 pregnant women showed baseline adverse outcomes comparable to the general population. So if you are pregnant and you take the vaccine, it's fine. What would you say to those who say, I made it this far without getting it? Well, you're lucky. That's all I can say. Fertility question, if someone is thinking of getting pregnant, we talked about this. There's no evidence to show that that the vaccines impact fertility in any way, shape, or form. As a matter of fact, both our society and the OBGYN society recommends these vaccines in pregnancy. The OBGYN society is called ACOG, and you can go to their website and see their full recommendations about that.
Here's a question about, what was your reaction to the vaccine?
What was my reaction after the vaccine? First dose, I didn't have anything. I'm assuming this is about adverse reactions from the vaccine. So after the first dose, I didn't get any type of adverse reaction. After the second one, I took it probably midday on, was that Tuesday? Tuesday. And then I was okay until the next day. I had clinic and I started feeling a little weak, a little bit of muscle aches, maybe a very low grade fever. Took an ibuprofen and I went through my day and saw my patients, and by the evening everything was gone. So it really wasn't anything that that put me out of commission at all. And yes, I was really excited to get it. I was one of the I was in the first group to um, ever get this. And if any of you follow me on Facebook, you probably remember my picture with the little vial of the shot. I was really excited about it.
You know, we've had very few.
Gonna come and
Yes.
talk about those.
And just to follow up on adverse reactions, so I think of all the different clinics that we've held and all the individuals that have come through, many of you have come through, we've had very, very few reactions. I think we had one gentleman at one of the Tabernacle clinics, and he had a rough day, but he also didn't eat anything. He'd exercised, and so we had a few people that were a little weak right after the vaccine. It's hard to tell whether it was truly the vaccine or whether it was anxiety, but overall they did well, and I think the vast majority of individuals have experienced, you know, the sore arm, maybe some muscle aches, maybe a low-grade fever, but I have not talked to anybody who has said it lasted more than about 24 to 48 hours. So a lot of fear about the side effects of the vaccine. I think you have to balance that out with the potential of getting the virus and the serious nature of being sick from the virus versus the side effects of the vaccine.
Do you want to say something about the?
I'll say something about the employee.
Yeah.
Yeah, so to piggyback back on what Marie was saying, we have administered close to 28,000 vaccines. And during these clinics, to her point, we've had very few people that have experienced any immediate side effects within that 15 to 30-minute window. So we've been very fortunate. We've seen people from all walks of life, all, you know, age groups, from, you know, the young to the old. And it's just been a very rewarding experience. I did want to include that out of our employees that have tested positive, we've had in April and May, we've had 24 people test positive, and out of those 24 people, none of them have been vaccinated. So to me, that's very compelling evidence that it is working. It's keeping our own employees, you know, safe from this virus. So we do hope that this will, you know, provide you with the information that you've been seeking, and that you'll give it some consideration. If you're kind of sitting on the fence with it, you know, hopefully this will give you the knowledge that you need to make that informed decision. And we will be hosting the clinic next Thursday, again in dining rooms 4, 5, and 6. And we do have the prizes. The drawing will be at 2 p.m. that day. We are very excited about it and hope that you all will join us.
The one more thing that I want to add, you know, there's a lot of excitement surrounding quitting the mask really after we get the vaccines, and you know, I think that's very important. You know, we keep saying, okay, folks get vaccinated, but then people say, okay, but if I still have to wear my mask, well, I think it's important to know that we are hoping to get to that point where we really won't have to wear those masks, and that is one of the endpoints of all this. Nobody loves to wear the mask when it's 100 degrees outside, and so we're hoping once we have enough people vaccinated that just won't be necessary. I think we're all you know, looking forward to those times where we can congregate even at work and you know, have a little work party and have our lunch together and all that. And we can say that most of the transmission that we saw here for COVID-19 was during those lunch breaks. Mm-hmm. So, you know, hopefully if everyone is vaccinated, or the vast majority of people is vaccinated, that won't become a problem. You should feel safe at work, and so I think this adds on to the safety of our workplace. For for our coworkers, for our patients, and so on. I don't think we have any more questions, so maybe we conclude this talk. I think it was recorded, so it'll probably be posted on the intranet, and y'all can watch it anytime. And again, if there are any more questions for myself or for Kim or Marie, we're always available, and we're happy to walk you through all the data that you need to know about this vaccine. All right. Well, thank you.